What are the risk factors for the disorders of the upper extremity related to the work, to the occupation? So, although many classifications exist, so we can divide it in many different ways, there are risk factors are divided into three main categories. Yes, work-related, physical, work-related, psychosocial, and personal. So socio-economic factors. So multiple conceptual models have been developed to better understand the relationship between this disease and the risk factors. And a lot of different factors were taken into consideration. So as we told, this physical one, yes, those most obvious one, but also some social ones, and psychological ones. So, for example, it is also important whether the worker is happy with his job, with his or her responsibilities. Things like that are also playing an important role. So, for office workers, for example, a systematic review concluded ergonomic variables related to the keyboard and mouse use, including use of the mouse more than 10 to 20 per hours, 10 to 20 hours per week, were risk factors for wrued. Awkward positions put increased mechanical stress on muscles. So generally, if we are non-comfortable, it leads to higher probability of some diseases, yes, because lack of comfort is generally related to some strain of the muscle, yes, and sustained strain of the muscle can lead to pathologies. Cold temperature. Also, the cold temperature, according to the scientists, is related to increased risk of work-related upper extremity diseases. Also, this is quite well documented that the vibrations of different types may lead to multiple pathologies. Of course, generally, vibrations are very frequently related to the upper extremities because when the worker is performing some job, he or she may keep the vibrating thing, like for a lot of different engines that are used in the construction engineering. They may vibrate really a lot, and are kept in hands. Yes, so primarily the upper extremities are getting those vibrations. Of course, those vibrations can be passed further on, yes, and lead to some neck pains and so on. But primarily, usually, they are through the upper limbs. And generally, there is also, as we already started to tell, correlation between the stress, work demands, control of work tasks, social support. So other things that seems not important still are important. And the work stress. Yes? So how much stressed is the patient? How much stress is the worker in the place of work? Whether he feels safe there. Yeah, things like that.